we're going to talk about prostate cancer. Yeah, everybody heard about prostate cancer. But how much do you know about prostate cancer? Where is it located? Does it pain? Or is it only affected with men and above 60 years old? Okay, today we're going to find out more in the next 1 hour. Of course, once again, my name is Steve Yap, today's host. Joining us today, we have 3 experts in this field. Next to me, we have our urologist, Dr. Badrulhisham. He's a robotic surgeon as well from Sunway Medical Center. Welcome, doctor. And
thank you.
Next, we have Dr. Ivan Shiu. He's an oncologist, clinical oncologist, again from Sunway Medical Center as well. And last but not least, a hero, because he's a cancer survivor, Stephen Kong, Mr. Stephen Kong.
Hello, hi.
Welcome, gentlemen. Okay, first of all, I want to ask doctors, any one of you, what exactly is prostate cancer actually?
Okay, well let me answer that. Prostate cancer is a cancer that affect the prostate gland.
Okay,
So-
only men, right? Is it
Well, only man has prostate cancer, has prostate gland.
Okay.
Yeah, and the function of prostate gland is to make semen, the
Okay.
liquid that comes out whenever you have sexual experience.
Okay,
Yeah.
like okay, you talk about sexual because in Chinese term, it's kind of like prostate cancer is like only for appear in testicle.
Yeah.
Is it
It's
not really, right?
No, it's different thing. I mean, that's not something unusual. I've had patients who thought prostate is their testis, but
Yeah,
it's
for
not
me,
just,
so, I mean, before
Yeah.
that, I thought prostate cancer must be is a lump inside the testicle. Is not.
No,
right?
it's not.
It's
Yeah,
not.
it's
Okay.
two different organs.
2 different organs. Or maybe I can ask Dr. Ivan Shiu. Okay, in Malaysia, how many percentage of men have this problem about prostate cancer? How many percentage?
How many percent? I think in the lifetimes, Malaysia is 1 in 90, about 94.
1 in
94.
So it's considered low or high?
It's
or
considered not uncommon because I think in men it's the 3rd most common cancer in Malaysia. Malaysian men.
Malaysian men.
Malaysian men. After the colon cancer and lung cancer, actually it's the 3rd most common cancer. for Malaysian
Is
men.
it life-threatening? I mean,
It used to be, thinking that prostate cancer is not life-threatening, but I think in our textbook, I think in the West they discovered it quite early because of PSA testing, tumor marker testing. They detect it quite early, so you pick it up at about stage 1 and stage 2. But it's not the case in Malaysia. I think most of the men in Malaysia discover this cancer at about later stage. I think stage 3 and stage 4. I think it's almost close to 50% of the men discover it at that stage. So to a certain extent that we call it life-threatening because it's more advanced. when
okay,
we
because
discover
you
it.
mentioned above 50, so it's only affect men above 50 or only older people? I mean, older men or younger men gonna have prostate cancer as well?
Not necessarily.
Not necessarily, but the chances for older men to get it is higher, is it?
Yes, you can say age is a risk factor. The older you are, the more risk that you may have prostate cancer. There was a study that was just recently published about a Malaysian man about a month ago, where from 2016, in about 9 public hospitals, they collected all the data of all newly diagnosed prostate cancer. And what they found was, just like what Dr. Ivan said, nearly 60% were all diagnosed at late stage.
Yep.
And median age, that means like the average age at when the diagnosis was made was about 70. 70, yeah.
Ah.
And you're asking, can a young man get cancer? Yes, it is possible. Within that cohort of men,
Okay.
within 2016 to 18, about 8% was diagnosed at the age of less than 40.
Less than 40, okay.
I think it's less than 40, yeah.
So,
it's still possible.
Oh, still possible. Okay, I go through some research. Prostate cancer is systematic. I mean, it's no symptom at it, right? We can't really find out. Can we breast cancer? We can do own checkup. There's a lump underneath our body part. Can we do that on prostate cancer?
I think it's a bit difficult. It's based on symptom because it's inside the body. So
So no way we can find out without going medical checkup.
to a certain extent, yes.
To a certain extent.
You need to go to see a
You know,
doctor.
even from our urine, you can tell, oh, something's going wrong. Or like I heard people say, if you wake up in the middle of the night, you go to the toilet, very frequent, that is a sign of prostate cancer.
Yeah,
Is that
exactly.
true?
Yeah.
Or is it just a myth?
It's well, that's the thing. Symptoms are very non-specific.
Okay.
Okay.
Yep.
So within the area in the pelvis, there's bladder which keep urine, and then there's prostate gland underneath the bladder, and any conditions that affect bladder and prostate, not necessarily cancer, will give rise to symptoms which are similar to each other. So symptoms such as frequent urination, very strong urge, uncontrollable desire to urinate, waking up at night to urinate or having slow stream. These are not symptoms which are cancerous in nature. It could be anything. It could be anything.
Okay.
Yeah.
Then I'm gonna get back Mr. Stephen Kong. I mean, from what I know, you found out about your diagnosis about prostate cancer in year 2010, right? When you're age of 50, at the age of 50.
Okay, what happened is that at age 50, I started to do my annual screening.
Okay.
Of course, part of the screening is the PSA screening. It was well below 4. I mean, 4 is the baseline. Anything above 4, that means that you have to take notice.
Yeah, sorry to interrupt you at that moment because you mentioned PSA. I'm sure a lot of people, like especially those who are watching now, don't know what is PSA. So maybe doctor, one of you can explain what actually a PSA is.
It's a tumor marker for prostate cancer.
Okay.
So rarely we can find a tumor marker for certain cancer that we can do screening. For example, for colon cancer, we can't just do a tumor marker and then to detect the cancer early. Quite difficult, but there is certain cancer that we can do the tumor marker and detect it early. One of it is prostate cancer.
So that is called PSA lah.
Yeah,
Okay.
PSA,
So
prostate
then it
specific
say you
antigen.
mentioned 4. Okay. So what is a normal safe the index? I mean 4, 3. What is that?
There isn't really a cut-off level to say if you're above a level, you have cancer, and if you're less
It's
than...
not like cholesterol because like we go to bed, some doctors say, oh,
Yeah.
your cholesterol
Yes.
above 6.5, something
Yes.
like that. You are high cholesterol. You
Yeah,
have to take
or
medication.
if there is, it would make our life a lot easier. Yeah. So you have to look at PSA as a measure of risk. The higher the level, the more chance that you get cancer.
But it's not necessary you will have prostate.
So it's probably good to just to throw numbers here. So if say in your case you had a PSA less than 4, roughly the risk of finding cancer in that man is about 15%. So if the level is say between 4 to 10,
So what's the maximum? Okay, now you say
there's
4.
no maximum.
There's no maximum.
It could be 4 figures.
Really?
Yeah, it could be.
You mean from 4 to 1,000?
Yeah, it could be
But for
1,000.
normally normal person, what's the index?
It would be like in Mr. Stephen's case, it would generally be less than 4.
Yeah.
Okay, back to you, Mrs. Stephen. So you found out, doctor, of course, when you first find out about this PSA and you don't know anything about it, right? So what was do you concern about, because everybody heard about cancer, say, hey, I'm gonna die. Does it really occur to you, affect you have you had thoughts of that?
I think I'm a bit different because I'm in the pharmaceutical industry.
So you understand
I
a lot
understand
about it,
about it, and then that's why in corporate normally for us we are given annual screening, health screening for managers. So that's why we started screening. So the first 4 years was okay. I was doing screening until and basically in 2012 my PSA started to raise above 4. So I went to see a urologist, and the urologist advised me to start on some medications to lower down the PSA, and it did well for a couple of years until 2015. After 2015, my PSA was still yo-yo, up and down. So my urologist advised me to do a trust biopsy to check and to determine is it any other underlying causes. So that's why I did it, and when my my result came out, and was confirmed that mine is cancerous, and my Christian score was a 3 and 4.
So, what's your first thought at that moment? You say, okay, you think, okay, because you are a pharmaceutical, field, so you know, okay, I'm safe. You know what to do, right?
Yep.
Are you saying?
I think at that spur of the moment when I went to see my urologist, I think he played a very important part in the sense that he gave me a lot of assurance, highlighting that the cancers that I developed is not at one stage, and there are various options for me to manage, like surgical interventions, go for chemotherapy. In fact, I can also go for active surveillance. Active surveillance means that don't do anything, just wait and see. Every 3 months I do a PSA to determine whether
it
grows or not. Yeah, that's right. So of course, I decided that to do surgery. That's how I underwent the surgery.
Just to highlight a point there that you've mentioned, that you started off with a PSA test, and that is not yet a confirmatory diagnosis for test for cancer.
Correct. Yep.
And you needed a biopsy in order
Yes.
to confirm whether you have cancer or not.
A biopsy is when you have to take a tissue from the
Yeah.
bladder to check whether it's confirmed it's a cancer
Yes,
cell. Or something
yes.
like that,
Just
right?
like say a woman who's got a breast lump will have
Okay.
a needle.
So,
Yeah.
so what? Poke inside and
Poke
take it
inside
out.
and-
So for this particular part, which part we are poking?
All right. So if we bring the model, I can
Okay.
show you where the location
Yeah.
of the prostate is.
Okay, maybe this is much clearer for the audience to see and what
So-
are we looking at?
So this is a cut section of a male body, basically looking from the side. And I
You
think
can recognize this part?
you
Yeah.
can recognize this part, the
Okay.
penis and testicle. So
Okay.
within the pelvis, if you press in front of the body here, you can feel your pelvic bone.
Okay.
And right behind that would be where the prostate is located. It's very much hidden from.
We can't feel it, we can't touch it, okay.
Yeah. And the urinary bladder will be sitting on top of the prostate.
Okay.
Yeah. So the only way to access the prostate would be to go through the anus. That's why urologists, whenever they examine the prostate, they will ask permission to do a rectal examination in order to feel for the prostate gland. Some cancers can be detected that way because a lump can be felt on the prostate.
You can't using an X-ray or whatever without physical.
Well, that comes next.
That
comes next. This is when the patient is there having
But
consult.
that's the best way, or is it?
Yeah. Okay. So in order to examine the prostate, you need a trained person to do it. You can't do it yourself.
And you are the one.
Yeah. Okay. So finger up the bum and examine the prostate.
It sounds pain to me.
Yes. And then in order to get tissue sample, unlike breast, it's so easy. It's just under the skin.
Okay.
Here, to get a sample from the prostate, it's either going through again through the back passage, through the anus again, or through a small area of skin located under the scrotum, under the testicle.
But all these procedures, of course, we have gone through anesthetic, right?
Yeah, it's normally done under anesthetic. Yes.
Okay, lucky to hear that. Okay, thank you. Or anything, Dr. Ivan want to add?
I think it's good to highlight that Stephen used to have so many options because
Okay.
he detected the disease early.
Okay.
But lots of time we see some of the patients come with a lot of symptoms for years, and then they have some other symptoms that the disease actually spread to the bone, for example, because prostate cancer tend to spread to the bone. So some of the patients actually
We spread to
presented
like bladder and other part of the body. as well.
other part of the body. So
Okay.
it's stage 4. So
Okay.
they presented with like pain. So in that kind of condition, their PSA can be 1,000,
Oh,
3,000,
okay.
4,000, yes. So, and during that times, then it will be stage 4. So the treatment options will be very different.
Oh,
Will
so
be
you
very
talk
different.
about pain. So if that is like stage 4, right? Normally happen only when you feel pain.
Yeah.
So you're gonna affect everything, your urine, everything, your sex life. Does it, Mr. Stevenson? Does it affect you?
To me, I don't think, depends whether it's a pre-operation or post-operation, because when I underwent surgical interventions, of course, one of the risk factors that the urologist highlighted is you may get erectile dysfunction, then you may get unable to urinate, control urinations, right? These are two main side effects.
Okay.
Of course, my operation was through
But
operatic
before you
surgery.
operate, does it happens to you? Before operation, when you first started, you have prostate cancer. At stage 2, is it? Not
Mine is stage 3.
stage 3.
Yeah.
But do you have problems like affecting your sex life, your daily life, things like that?
No,
Not
it
at
didn't,
all.
it didn't, it didn't. Yeah, that's right. So that's why, because I detected early, I think at 55, at 5 years ago, I think it was considered one of the early stage. So that's why I didn't really get much kind of discomfort,
Okay.
like urinary pain in the urinations or pain, bloods in the urination. I didn't get that. It's just that the only way that confirms my elevated PSA is through the test. So
Okay.
I don't have enlargement of the prostate to the extent like those who are at 60.
But because
70.
you go through, you detect it at early age. But for people who detect it later, there will be different, right?
They will have more. They have some kind of symptoms
Some kind of symptoms like
Relate-
this wrong. Okay.
related to the extent of spread.
So that means we have to go through, body checkup every year, like advice, especially PSP.
Yeah, generally the advice would be when you reach the age of 50, you should
My age.
Yeah.
Oh,
you,
no.
you should consider having this kind of screening
Okay.
test. Yeah, and if you do have risk factor, and here the risk factor would be a family history of
Oh
cancer.
yeah. So it's genetically.
Yes, it's possible. Yeah. So
Possible.
if you have, say, a brother or a father with cancer,
Okay.
that would
Your
put
chances are.
your chances goes up double.
How about race? Like certain race, because I search on
Yeah.
online, say African American have a higher chances
That's
of
right.
getting prostate.
That's right.
Why?
It's multifactorial.
Okay.
It could.
How about in Malaysian, or that certain race, or Chinese, Malay, or Indian, or Karazam, is a higher chance of getting prostate cancer?
I think Chinese get it more.
Yeah. Yeah.
Is it because of our diet, or
We are not sure.
Yeah.
I think it's still.
You don't have the
I think
answer.
it's multifactorial.
Multifactorial.
oh, so in Malaysia, Chinese have the high? I mean, among all the races,
Yes.
Chinese
Yeah.
have the higher chances.
So if I bring
Chinese.
back to the recent big study that was just published within the 2 years, 2016-18, roughly about 1,800 new cases were detected, and of those, about 45% of them were Chinese, and about
no.
38% was Malay, and about I think 10 to 16% was.
This is very high
Indian.
because Chinese only make up 25% of population, and
Yeah.
we make up
Yeah.
45% of the
So
cases.
again, I think it's all multifactorial. It depends on, say, maybe genetic, food, environment, socio-economic, level of education, geographical distribution, things like that. So you can't just
we
say.
can't really tell. But
Yeah.
is there any food or anything prevention? A lot of people say prevention is better than cure. Is there anything we can do before it happens? Any particular food? I heard about tomato helps. Does it?
There are some study that shows that tomatoes help. There's some study that shows that some of the soy protein, like soy sauce, help. I mean, but we don't have solid evidence.
Okay, we don't have it yet.
But
Because
that-
for me, I love tomato since I was very young. So I think I'm quite safe. But now you're saying this, no.
I think the main factor is still age. So more aging is the populations. If a certain population, a certain age group, I mean certain ethnic, they live longer, I mean naturally the chance of you getting a prostate cancer will be higher.
Okay. Okay. Maybe there's some question. Okay, let me check. There's some question from the audience. They want to answer our guest today. Let me see. Okay, there's. Okay, he want to the doctor for stage 4. The pain will goes to pelvis or lower part of the backbones.
It's very hard to say. It depends on whether the prostate gland is enlarged or not. But sometimes the prostate cancer can be very huge, so it gives rise to a lot of urine symptom. And if it spread to the bone, it depends on which part of the bone is affected. So if the backbone is affected, usually backbone will be affected, then you have back pain. So some of the patients, they present with years of urinary symptoms and they never see a urologist before. They never have a PSA test, so they detect it late, so it spread to the bone, and affected bone will be painful.
Oh, okay.
So it mentioned about bone pain is the answer. Yeah, the bone pain correlates with the site where the spread has occurred.
Yes.
Oh.
So some unfortunate men actually experience fracture of that site.
Really?
Because the site where the tumor has spread caused the bone to be fragile.
So at that stage, what can we do?
Well, first of all, straight away you know that this is already stage 4 cancer.
So the only way is through surgical?
No, well, as to stage 4 cancer, the intention of treatment is no longer to cure, but the intention of treatment is to
Prevent it from spreading even further?
Yeah, by minimizing the effect of the cancer and trying to prolong survival as much as possible.
Oh no, that means, okay, sorry to hear that. So, back to Mr. Stephen Kong. Okay, can you tell them more, what is the journey? Because you say 2015, then you found out about prostate cancer. So what's the first thing you do after, what kind of treatment you use back then?
Okay, when my urologist highlighted to me the various options, of course he also highlighted the pros and cons of various options that he offered to me. So to me, why I choose surgery is because I find that I don't want to just linger on with all the problem, you see. So I felt that was the best option for me. Also the reason why I choose surgery is because today with the advancements of surgical intervention, especially with robotic surgery, I think the success rate will be very high, and then is less invasive as compared to 10 years, 20 years ago, you see. So I think I was more confident in terms of going through surgical interventions.
Okay.
Yeah.
So, you talk about robotic surgical thing. I know, Dr. Badrulhisham, you are one of the, I think, less than 20 surgeons in this particular robotic, right? So can you tell us about what is this really, or robotic surgeon? Surgical things.
Right, okay. Not all patients with prostate cancer will need to go through it. So we have to sit down, look at all the details of the information. If the patient is suited to have surgery, then we'll offer surgery.
Okay.
And robot is just a way to remove the prostate. Yeah. If we look at statistics, I think more and more patients are opting to have robotic assisted surgery.
But this technology is just, I'm sure it's just invented like this recent years?
Oh, it's been around since the year 2000.
Oh, 2000, then more than 20 years?
Yeah, more than 21 years. And
because of course the technology is getting better and better, right?
yes, the robotic platform itself has gone through generations. We are now in the 4th, 5th generation.
Okay. But when people hear about robotics, people think about you let the robot to operate. It's not the case, right?
It's
you
not autonomous.
You still have a really operator, a qualified surgeon to operate it, right?
Yeah. So the robot is not autonomous.
Okay.
It cannot move by itself. It's just a way. It's manipulated by the surgeon.
But it's precision because of you're not shaking, your hands not shaking, right? Something like that, right?
Yeah, something
and
like
I
that.
know there's only like 20 robotic surgeons in
Roughly,
Malaysia,
yeah.
And Malaysia is one of the cheapest.
Yeah, because
among Asian countries.
And
And more advanced, right? That's why recently there's a lot about so-called medical
tourism.
They always love to come to Malaysia because of our technology, our professional and things like that, right?
Yeah. Well, I suppose a lot of us are trained.
Okay, but I'm not sure whether I should ask Dave. How much does it cost? Approximately.
Well, when we're talking about robotic assisted surgery, this platform are available in both public and private hospital.
Okay.
So obviously in public hospital, it's very much heavily subsidized. You probably pay next to nothing. In private hospital, it may be somewhere in the region
Five
of
figures?
five figures,
Six
yeah,
figures?
5 figures, yeah.
5 figures.
Five-
Okay, 5 figures.
5 figures, yeah.
5 figures, not
Five.
up to 6, huh?
No, 5 figures.
Okay, then still, as long as you have insurance cover, then still you're safe. Okay, next question. There's one question from Marine Lam. Do we need chemotherapy after surgery?
It depends, but usually no. Usually no. Yeah. But most of the patients we don't give chemotherapy after surgery. We apply it in more advanced cases like stage 4 cancer patients. Yes. But for certain patients who are very high risk, there is some study that shows that giving chemo is help in reducing the mortality.
Yes. Beside chemo, and actually, how many kind of treatments can be cured for prostate cancer beside the chemo, robotics, surgical? Anything else? Medication? Does medication help?
Yeah. We give radiations. Radiations. We can give radiations or even stage 2, stage 3 cancer, and then to cure the disease. But in terms of stage 4, then the modality of treatment will be very different. So sometimes you give chemotherapy. The mainstay of treatment is still hormonal therapy.
Okay.
But on top of that, we add on oral targeted therapy and also chemotherapy.
I'm sure all the treatment you mentioned just now are available in some medical center, right?
Yeah, it's available.
Yeah.
That's the most important
Yes.
part. Okay. Next question. We have guest Raymond Chan. He's asking, in simplistic terms, aside from annual health screening, what are the basic symptoms to be observed? Doctors, anyone?
One is, I suppose, level of awareness that after you reach a certain age, because early prostate cancer has got virtually no symptoms, you need to speak to a doctor
You
and
need to,
just have a chat, basically.
Even like you, okay, just, I don't know.
Yeah.
You have difficult erectile function, it's not the symptoms, right?
No, no.
Okay.
There's no one single
No one single
symptom that
symptoms.
would say you have cancer. Yeah. It's not like having a breast lump.
Okay.
That's so simple.
It's not as simple as that,
It's
right?
not as simple as that.
Okay. Okay, then let's see. Okay, is there any way to reduce pain of stage 4 cancer patient? She said her grandfather are taking, I don't know what is this, a medical term?
Abiraterone.
Well,
Abiraterone is a
what
form
is
of targeted therapy medication.
Okay.
Yeah.
Okay, maybe you can elaborate on that, because as a layman, I don't know what is that, because it's a medical term, right?
But usually pain is because of the bone involvement and the disease actually spread to the bone.
Okay.
So a few things that we will do. If the bone metastasis is threatening, sometimes threatening the nerve, then we will give radiotherapy or even surgery, emergency surgery, because sometimes it spread to the bone and it's actually compressed on the spinal cord and it can cause paralysis. So there will be emergency surgery to correct that kind of conditions, followed by radiotherapy. So these are a few forms of modalities that we manage patient in order to control the disease. And most important thing is a painkiller, which is painkiller. And hormonal therapy will control the general disease. The widespread of disease, then we control with the hormonal therapy. Add on with the targeted therapy.
Okay.
That is a targeted therapy.
Okay, now aside from all these mainstream or Western medical treatment, I'm sure some patient might use a so-called traditional method. I heard about like some kind of like Tongkat Ali or this and that. Does it really, is it a myth or does it really help? Because I heard testosterone, the higher testosterone you have, the lower chances of prostate cancer. Is it true?
That's not true. I think that's not true. Yeah. So.
But somebody claims, I don't know.
Yeah.
You know, now you have a lot of so-called some kind of vitamins or whatever health products. They claim they're gonna help you. I don't know.
I think you still have to be clever and always try to be sensible.
Okay.
Too much of something or too little of something is probably not a good idea.
Okay.
So you always
But
want to
they
be
don't have the
sensible.
data to support them, right? One of the reasons.
Well,
Because some of the some patient they claim it helps them. I don't know.
yeah. We always have to be careful about testimonials because it's not
Yeah,
scientific.
not scientific. Yeah. Just like before that, we heard about ivermectin and things like that, right?
Yeah.
Okay.
Yeah.
Okay. Maybe you can go back to Mr. Stephen Kong. Okay. After like 2015, you say you're not afraid of it. You're very confident your doctor gonna help you, right? So, are you fully cured right now?
I think cancer, there's no such thing as fully cured. Right? What is important is I think we need to be careful. We need to monitor ourselves. I mean, the food that we take, the things that we do. I think we have to manage that. Like for my case, I had my operation in 2015. My PSA was well contained, but after 4 years, my PSA start raising again. We call it PCR, biochemical recurrence. And then I went back to see my urologist, and my urologist monitored me for another year and a half to make sure that I do not reach a certain level, because this may not be too good for me. So the next course of action I do is I seek the advice of the oncologist. What treatment can I opt for after my surgery? That's why recently, in fact, in May, I just undergone radiotherapy. And basically, my oncologist is Dr. Ivan.
Oh, okay.
Alright. So I went through 33 fractions of the radiotherapy. I think what's important is patients should not be worried when they are having cancers. Most important is they must make sure that it's managed by a qualified doctor, not someone who is a layman. Especially,
I tried this, so maybe you can try this.
Yeah, that's why I always tell my my support group that when you strike with cancer, you have more friends, more relatives. The imakute, all those who tell you do this, don't do this, eat this, don't eat that, which confuse, which is very confused.
You're very confused.
Yeah,
Right?
that's why I always tell them that when you reach this juncture, most important is only listen to the advice of a qualified doctor.
Yeah.
Right, because he is trained to manage you.
Okay.
Right, that is most important. Right.
But the thing is, because we, like both doctors just mentioned just now, there's no way we can prevent. We don't know what's the cause of it. Because as I know, you are very active hiker as well. You've been very active. You live a healthy lifestyle. Do you smoke, or are you a heavy drinker?
No, I don't smoke. I don't drink in a sense.
But yet you still get polluted too. That's the problem, right?
I think I always blame that my cancer, because it doesn't really run in my family.
Your grandfather.
No, it doesn't. I think that I always feel that it's stress. Mine is a stress-induced cancer.
Okay.
Maybe the doctor can share with you about whether stress do induce cancer.
Your story, I say, okay, same to me. You Steven, I'm Steve.
Yeah.
I'm a very active hiker and mountain biker.
Yeah,
I don't smoke, I don't drink. Yet, oh no. And you got it age of 50. Oh, next year I'll be 50.
Yeah,
so should I be concerned, doctor?
I mean, just look at our badminton player, Dato' Lee Chong Wei.
Okay.
I mean, he's so healthy, and yet he has nose cancer.
But we don't know.
We don't know. Yeah, that's right. Yeah.
This is something that can be observed in the consultation room whenever you break out the bad news to a patient. A very healthy patient who's a hiker or Ironman.
Yeah, then people ask, why me?
Why me? Yeah, why me?
Yeah, okay. Okay, I think we have another question coming through. Let me read it. One moment. Okay. It's the same thing. No, I don't have it. I don't receive it. Never mind. Okay. So there's no particular way to find unless we go to PSA checkup every year. Okay. Mr. Stephen Kong, I know you're Prostate Cancer Society Malaysia's secretary. Actually, what exactly does the Prostate Cancer Society do?
It's a very good question. Okay, Prostate Cancer Society was formed in 2016. In fact, our function is basically to provide support, educate, and also try to improve the quality of life of the survivors. I think that every cancer patient must have a support group to basically to manage him. Two things that I think is very important: support group and also caregiver. I think the caregiver also play a very important part. So back to Prostate Cancer Society, we have currently about 400 members, survivors. We organize a lot of talks to basically to update our patients, because our vision is to be a leading advocate for prostate cancer awareness.
So you support them like emotionally and psychologically, not financially, right?
True enough. We wish to be financially. Maybe that will be the future.
That's your goal, because I'm sure
Yes.
there's someone out there. Okay, without insurance, find out I have prostate cancer. So what can I do? Where can I seek help? Is there a foundation like other cancer? There's a so-called foundation to help this patient. Do we have that in Malaysia?
Unfortunately, at this moment, we don't have a foundation that can really provide financial assistance. So normally what we advise them is if these patients are not able to afford the medications, we always encourage them to go to the government hospitals and then go to the kebajikan to seek for financial assistance. That's the only source of finance assistance they can get at this moment.
Okay, I have a question from Winston. He say, okay, there are some recommendation to take cassava cooked as part of the meals. Are you able to share your views? I don't know. Is it cassava?
Yeah,
Yeah.
cassava.
What is that?
Not actually quite sure of that, but there have been a number of studies that look at supplements.
Supplements.
Just like what Dr. Ivan
Cassava
said
is
just now.
some kind of supplement?
It's a bit like taking soy products.
Because it's okay.
But some of it is just for cancer prevention. It's not
It's
for cancer
prevention,
treatment.
it's
Because
not-
what we heard a lot of things in the internet. Sometimes they will say certain food is good for cancer, but lots of things is actually for cancer
Yeah.
prevention. Or once you're diagnosed with cancer, you need proper treatment.
You need proper
actually.
treatment.
Treatment, huh? Okay. Another question. I think I hope I pronounce it correctly because medical
Laparoscopy, surgery versus robotic.
which is safer?
Well, that's a good question.
Okay, first of all, what is that?
Yeah. Okay. So I'll bring in other terms. Yeah?
Okay.
Keyhole surgery.
okay.
Keyhole surgery. Yeah.
Okay,
Okay.
that's
So
English.
instead of having a big cut to get access to the prostate and remove it,
Okay.
we can just make holes on the body and operate through those holes. All right. So
But
before.
that is doing by a surgeon, not through.
It has to be done by a surgeon again. Yeah.
Not using
Well,
a
well,
robot.
there's a lot of similarity between robot and laparoscopy because in both type of surgery, we operate through holes made on the abdomen. Right. What's different is the devices that's used. Okay. So before we have robotic, we were doing.
the old method.
Well, no, it's still being done now.
Yeah,
Still being done. Yeah.
So okay.
You mentioned there the difference between laparoscopy and robotic. So before robotic platform was invented, everyone was doing laparoscopy.
I'm sure you know how to operate on that
Yes,
method. as well, right?
before we did robot, I also did laparoscopy. But the robotic platform helps to overcome a lot of the issues faced by laparoscopic surgeon. It
Like?
made vision. The vision is much better. Instrument, it's more precise. It can make the surgery to be conducted in a more safer and faster manner.
Is it not so stressful because you're not sitting, you're not operating? I mean, one-to-one, you're sitting in another room,
Yeah,
right?
and,
So
yeah.
it's not the tense. It's not so the tension, the pressure is not so high compared to.
It takes a bit of getting used to not standing beside the patient and having your hand there. But it's just training.
Okay.
I think
Yeah.
from the patient point of view, in fact, I was also given a choice whether to do a keyhole laparoscopy or a robotic surgery. Of course, we have to look at the pros and cons. You see, the reason why I opt for robotic surgery because it's less invasive, and then the recovery period is much faster. I mean, like my case, after my operation, next day, my surgeon asked me to take a walk. But I mean, if I were to go for other surgical interventions, maybe I have to lie on the bed for a couple more days. And then the other two factors is more important is in terms of erectile dysfunction and also incontinence. I understand that by using robotic surgery, the risk of both factors are much less as
Lower.
compared to the conventional methods of managing surgery.
So by what you gentlemen say is robotic is safer, in so-called,
Yeah.
right? Okay. Okay, I think we have another question here. Check. For stage 4 person, we should go for oncologist or urologist. We went to urologist previously and taking hormone medicine, but now I'm more concerned on how to reduce the pain of lower part of back bones and reduce the side effect of having the medicines. Oncologists and urologists. So
Usually you need to see a urologist
Yeah.
first for a
There's a-
diagnosis.
yeah.
okay,
You need to
there's
get
a
a
different
tissue
opinions, right?
analysis.
I'm sure.
It's like a flow of thing. Like in the beginning, a patient will go and see a GP or a screening center,
Okay.
and then from there on, they had their PSA test and it was abnormal, and the first port of entry would be to see a urologist, and then the diagnosis is made, and depending on what stage the cancer is at, he may stay with the urologist, or he may then be co-managed with an oncologist.
But still depends on each patient, right? Is it? No?
That's the natural flow of care.
I'm sure because both doctors have different opinion then.
Oh no, well we may have different,
Right?
but we
Then
try.
one about, okay, you gotta go to surgical, then they say no, blah blah blah, and things like that. And then what should I decide? Well, maybe I'm
Okay,
have you gone
as
through
a,
that?
as a patient, it depends. Is in the sense that let's say once we get a PSA, usually the GP will recommend you to see a urologist first. Actually, that's the first point of entry. Urologist. It should be managed by the urologist. If, I mean, for early, I call it early detection because we don't know what stage we are. You see, that's where the urologist will do all the tests, you know, the biopsy tests and so on and so forth. Then from there, of course, after the result comes out, I'm sure the urologist will also give advice. Does it be treated by the urologist or need to be further referred? Depends on the staging of the cancer. I mean, that's
Yeah.
my opinion.
Yeah. Even just to add to that, even at early stage cancer, the patient can be treated either by the urologist or the clinical oncologist, because a patient may opt for surgery or radiotherapy.
Okay, this is one way of treatment. Another is the emotional treatment. I'm sure only Mr. Stephen Kong can answer us about that because you are the survivor. So your society help support. How do you support? You say psychologically. What kind of support you're talking about?
Okay.
Like advice, like what kind of, because you have gone through that, I'm sure they come out of if, like, let's say myself, if I found out I have prostate cancer, first of all, oh shit, I'm gonna die. Cancer, because it's cancer. Everybody thought that cancer is incurable and things like that. Gonna affect my sex life, things like that. So what you gonna tell me? Let's say I'm the patient, I'm just find out I have prostate cancer.
Okay, usually it's always like that. Our members are referred by the fellow oncologists or urologists to us. And the reason why they refer to us because I think these patients need someone to talk to, someone in the same boat. I mean, the journey that they've gone through, which they have not started the journey. I think we build confidence on the patients, right? You highlight to them what should be done, what should not be done, especially in society. We're very concerned of patients when they go into those other forms of treatment. I mean, they go through, let's say, some unqualified traditional treatment.
I'm sure you have a lot of members. They have gone through different kind of method, right?
Yes, it's
Then
true.
everybody telling you different things.
Yes.
Then who should I listen to?
Yeah, that's why in Prostate Cancer Society we only advocate mainstream treatment, management which is evidence-based.
So it's like someone who come and, hey, no, I'm using this traditional medicine. You should try this. No, they are not are accepted or not welcome in your society?
That's why we always give this patient advice why he take this. A very good example, one of the patients who came and see us, he was treated by a non-mainstream, mainstream treatment, that means medical treatment. He spent about 40,000.
40,000?
Yeah, for 1 year. By the time he came to us, in fact, his kidney was damaged.
Okay.
All right. So he was lucky that someone referred to him and then talked to us. Then we highlight to him that what are the do's and don'ts, and then we say that the proper channel of management is you should see either a urologist or oncologist. I think we are just like basically it's a halfway house, because cancer patients, especially in the early phase, they are at a crossroad. They don't know what to do, and they always listen to all those people who are just a layman, which is very wrong. So that's where we correct them, you see, because we only lead them to the right pathway.
When was this society was founded?
This society was formed in 2016 by.
Just very recent.
Yeah, that's right. In fact, we are very
By
young
you?
society. No, it's by Mr. Das and his team. He's our past immediate president. He himself is a prostate cancer survivor.
As well.
In fact, all the EXCO members are all cancer survivors.
How many members do you have now?
We have 400 members.
Oh, 400 members, okay.
Yeah, that's right. We are very active. In fact, every month we organize
A meeting.
Zoom talk.
So do you have a
meeting.
so-called a particular a place to meet, office, or I don't know?
Before MCO, we have physical meetings. We go to the various hospitals like Sunway Medical Center, GH, right, and all the few of the, in fact, from Penang, Johor, we have altogether 13 centers. So we provide physical counseling support. Yeah, but because of the MCO, now we only could do virtual meetings.
Virtual meeting.
Yeah, that's right. But I find that these virtual meetings helps them a lot, building their confidence. At least they know what is their journey.
Yeah, maybe you can show us with your slide. I think you prepared some slide for us, right, to show to the audience?
Yes, I mean, basically, what I think it's important to know. Yeah, it's very important to know what is our vision. Prostate Cancer Society, basically, our vision is we want to be the leading advocate for prostate cancer in Malaysia, awareness. I think, unfortunately, awareness of prostate cancer is still very low as compared to breast cancer. Breast cancer, there are so many.
Yeah, because they're very, very common.
Yeah, they're very. I mean, there are so many advocates to basically to talk about breast cancer, unlike prostate cancers. And of course, our mission is to provide support, right, and to educate. I think educating them is very important because most of them are very ignorant. And also, we want to improve the quality of life of our prostate cancer survivors. As I'm sure the doctor agreed that we have one of the lowest mortality rate in terms of the cancers. So I think we need to prolong their quality of life. You see, that's what we do. And the other thing is, these are some of the activities that we have. We are very active. Almost every month we organize talk and to the layman as well as also to the survivors. Of course, we appreciate from the fellow doctors. They really support our societies in giving updates in terms of disease management to the patients, and also how to contact us. Everyone can join our members.
Even if you are not cancer.
Yes, the only thing is our live members is only for survivors. The rest, caregivers.
Maybe you have relatives or friends who are not able to join you because maybe they can't converse in English or whatever. Because like some of the audience, they say grandfather might not able to walk, how to meet, they can't even use how to use a website, I mean online, all these things. So but they need the information.
Yeah.
So they need their relatives to help them. Can they do that? Can they join on behalf?
Yes, as a caregiver, I mean the caregiver can be the primary member, and then as a caregiver to the survivors, we have this associate membership, right? So they can join us.
So membership, sorry, you talk about membership. So there's a minimum membership you have to pay or for the society?
Oh, okay. Our membership is for life member for survivors is a one-off 60 ringgit. It's 10 ringgit.
Okay.
Yeah, that's right. We charge.
That's for administration.
Yes,
fees,
that's right.
Okay.
And for associate members like the caregivers, supporters, or healthcare professionals, they can join us. It's also about it's also 60 ringgit, $10 for 10 ringgit for
annual.
subscription for administration, and then 5 years of subscription.
Oh, okay.
So we encourage a 5-year subscription.
Okay.
After all, it's only 60 ringgit. I think
Okay.
a lot of people are affordable.
Oh yeah, sure.
Yeah.
Yeah, you organize a lot of that. Do you organize charity event for those who can't afford?
Not at the moment because
Not
we
at the
don't
moment,
have the
but planning
financial. I mean, we wish to because we don't have the financial resources to basically to assist at this point of time. So only that's why if the patients are not able to pay for the medication, as I mentioned earlier, we always encourage them to go to the government hospitals. That there is a revenue for them to seek financial assistance. I mean, that's the role that we play, see, because we can redirect the patients.
Yeah, one thing I heard, okay, like some women presented, do you have like some to help those who need it? I'm not sure whether doctors you're aware of that. Like for those who patient, there's some kind of like in legal terms, they're pro bono, free medical services for those who can't afford. Do you aware of that?
I think in
Maybe I can ask for you. Never mind. You're not aware of that.
well, radiotherapy side they have I think from a patient from means with a referral from government center, they give a 50% discount for radiotherapy for the radiotherapy.
50% discount.
But it's quite a big amount actually.
Okay.
Yeah, even for patient who requires robotic surgery, they can go through the hospital.
I mean, government hospital.
No, we're talking about private hospital
Okay.
care. They can go through the hospital management and have a discussion about what are the ways.
Or they can still offer some discount.
Yeah.
Okay. Good to hear that. Okay, let me check whether there's any. Okay, maybe Mr. Sivong, is there anything you want to add on?
Back to the Prostate Cancer Societies, in fact, we have a website, they can visit us, and we also have the email, they can write to us for more inquiries, you see. So maybe we can show our website, that is www.prostate.org.my, and also they can write to us to our email is pcsnmalaysia@gmail.com. Or they can even contact us because we have 5 of us. Our number is there, our mobile numbers. They can always contact us if they want to talk to us by all means, right? And also, if any public would like to donate to our society for a good cause, please donate.
Yeah, of course, you say donation.
Yeah.
Yeah, of course. But they will ask, if I donate to you, what's the money going to use for?
Okay. Because we need funds to basically to run our society, because especially when we have our physical meeting, so transportations, we have rental of our office and so on and so forth. You see, we print leaflets to generate awareness.
To the public.
Yeah, that's
Okay.
right.
Okay, I have one question from our audience. It said, if my grandpa went for a urologist and taking hormones medicine in the meantime, but now he's still having pain and getting weaker. For that situation, doctors are you recommended to go for oncologist or still go back to urologist?
I suspect the patient would have to see both doctors.
Okay.
Both doctors.
Okay.
Specifically to find out what are the issues that the patient is having.
Oh, okay. Maybe you
Be-
should ask
be-
how old is your grandpa, right? Is
Yeah.
that age?
Generally, I suppose the
70
patient
plus.
would be
70 plus,
70
right?
plus, yeah. Being put under the hormone I might be wrong, but may indicate that the patient is already at stage 4 cancer,
Okay.
or maybe at least stage 3. And it's given to minimize the progression of the cancer as much as possible so that life expectancy can be prolonged. But it does affect some degree of quality of life. The hormone can make a person feel a bit weaker, tired, lethargic. Yeah. So if that's the case, we need to speak to the caregiver, the patient, and find out what are the ways that this thing can be minimized. One way of minimizing that is exercise prescription, actually.
Exercise.
Yeah.
Okay.
Yeah, getting.
But Steve has been a very active hikers, right? But we never know, right?
Yeah.
How active do we need? I mean, of course, there are a lot of people exercising the way of prevent for all kind of diseases. But still, we never know. Okay, back to just now the cassava. Somebody say it's some kind of what, ubi kayu.
Yeah.
It's a Malay traditional things.
I've actually, honestly, I've not heard of it.
No,
not
heard of it.
Yeah, yeah. But what I was going to say, from time to time, we may hear about certain kind of food supplements that is believed that
But
they
it's
can.
all claims, not proven.
Yeah.
But usually, sometimes we will classify this as alternative treatment.
Okay.
But
do you discourage or it's up to you? You can use both methods. Does it help or maybe affect the treatment they are using, like the Western medicine, and still at the same time they're using the way they believe it's gonna help them? Will you discourage or you just let them be?
Well, I don't know about Dr. Ivan, but in my case, I don't discourage. I think so long as they still come and see doctors and seek expert help, and the treatment is not contradicting with.
They still can take whatever they're doing.
Yeah.
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 I would like to share with you one point about this is because like we also receive a lot of our members talking about supplement treatment, right, alternative treatment. We always tell them that whatever you do, make sure that whatever you take, it does not replace the medications given by a doctor, prescribed by a doctor. That's most important because we do have cases like they say that taking this maybe to reduce
But because old people, just like my mom,
Yeah.
they used to believe in Chinese medicine.
Yeah.
They won't listen to doctors, but yet they want their children to become doctors. So the thing. So we just let her be. Okay, you can whatever believe in your so-called Chinese medicine, but at the same time we bring her to see a doctor, so they can do medicine at the same time.
Yeah.
So the only thing, if whatever medicines, supplements they take, is always good to share with the doctor.
Yeah.
Yeah.
Because the doctor will be able to give advice whether should take or should not take. That is very important.
Yeah. Okay, back to just now. Her grandpa is 78 years old. So maybe that explains it all, right?
Yeah.
But it's quite difficult to give advice
Without,
without
knowing
seeing patient
yeah.
and the whole clinical scenario. Because most of the patient, like cancer patient, the treatment is complex and you need actually multidisciplinary care. Means I can't say that this patient just needs a urologist or see oncologist only.
So always opt for second opinion or third?
You can seek that.
can
This
say
is
that.
what we usually encourage patients. Means upon diagnosis, it's good to seek second opinion because you get more information. But you try to do it within a certain time frame, like within 3 weeks or 1 month. You will see a few doctors and make a decision of what to do.
Okay, this is maybe it's a silly question because nowadays because of internet, Google, everybody tends to look for Google when they have questions. Because in Google, if you type cancer, prostate cancer, they come out all these. What should I do? So in a minute, I'm not sure both doctors have you gone through. Check it out. Is it true what they're saying in the internet right now? Because some of it is not really correct information they are given.
Yeah. Well, yes, I think it's 2021. You're not going to get away from this anymore. So in the beginning, I have a different perspective, but I have changed now. And I thought, initially I was quite against it, but right now I think it actually probably it's going to be quite helpful to the patient.
Okay.
It makes them
do
do some research. They learn a bit more, even though their understanding may not be that good. But when they come to see us, they will start to ask lots of questions, and questions are good. And the job of us here is to try and help clarify and steer them towards the right line of thinking.
Okay. Dr. Ivan, you want to add on anything?
I think search using Google, everything is good, but you need to be guided because there's a lot of information and a lot of misinformation which is not correct. People talking about cancer prevention, you take it as a cancer treatment, for example. So it needs to be guided, and please see a doctor as well.
Okay, maybe this okay. Like another thing is like cancer always related to what? So radioactive or microwave. That thing does it affect cancer growth as well?
Not really, because this radio wave, microwave is not enough to break the DNA basically, because cancer forms because of DNA damage.
You can continue putting your phone in your pocket.
Okay. That's actually you know what I want to ask.
Yes.
Okay. Okay, I think there's another question. Say, doctor, the patient is 69 years old, is diagnosed with prostate cancer,
PSA, PIRATS.
PIRATS S3. May I know what would be recommended treatment? Is there any medicine that can help?
Okay, I suppose this patient and the caregiver is still going on the early stage of finding out whether there's actually cancer or not. The word that is mentioned there, PIRATS 3, is a classification made based on a scan, a type of scan called multi-parametric MRI of the prostate.
Okay.
So it's, for you, it's just a scan. It's just a scan of the prostate. Okay. So this patient would have gone through the test, the PSA test. Usually, if there is a scan, it will be done. The next scan that will be done would be this scan, particular scan called multi-parametric MRI, which would classify a lesion that is seen on the scan, whether it's the low risk or intermediate risk or high risk.
For the next treatment.
It is still not diagnostic of a cancer. It's just again a measure of risk, and based on this measure of risk, the urologist would then decide whether to advise the patient to have a confirmation test, which is a biopsy in this case.
Okay.
So a lot of PIRATS 3 lesion seen on MRI would be biopsied because the chance of finding cancer in those lesions would be about 50%.
Oh, okay. Let me see whether any more questions from the audience. Okay, let me check. I'm sure there's a lot of questions. I mean, before that, okay, maybe I have a few more my personal questions. Because as my age, I have high chances. Okay, let me see, give me 1 second. Where is it? No, is there any more? Let me see. No, okay. Gentlemen, so in conclusion, about prostate cancer, there's no certain way to prevent it, but the only way, can I say the conclusion is we need to go through a PSA checkup every year, especially for men above 50.
That is the general advice. It has to be done with some kind of counseling. So to just go for the test but not knowing what happens after that, it's probably not the right way. In the Western society, PSA test is done with counseling.
Because nowadays we have a lot of clinic, we have all these tests. But I'm not sure whether they have a so-called urologist or oncologist to explain it to us after the medical report.
As far as I know, no. The tendency is that once the reading is high, they get referred to the urologist.
So
I think the point is if you have symptoms, see a doctor and do a PSA. But I think in Malaysia, probably PSA is not commonly done even. Even patients who have symptoms, they never complain to doctor and never have a PSA for many years before they get diagnosed with a stage 4 cancer. So if you have symptoms, then go and see a doctor. This is a more crucial part.
I think that's where our role comes in prostate cancer society, is to try to create greater awareness among the public, men especially at age 50. So they need to know something about it, because I always tell my friend that the lady, they must have a gynecology friend. Men should have a urologist friend.
Okay, doctor, I got a number. I'll call you on.
Direct line.
That line. Okay. Last question. Okay. This patient asks, my last PSA test was January. Was 0.1. It was previously 0. It is necessary to have a PSA test every year or 6 months.
That's interesting. That is quite a low level of PSA.
This is very low. Come on.
So it's not mentioned by the person whether the patient has had some form of treatment.
Yeah.
Oh, okay.
It sounds like somebody who's had either surgery or radiotherapy
Okay.
Yeah.
to be possessing that level of PSA. Yeah.
So okay. This is the last question. Okay, this is not medical terms.
Yeah. So this is question maybe Dr. Ivan can answer this. This is about abiraterone, enzalutamide, and apalutamide in curing prostate stage 4 cancer patients.
That's me really. I don't know you know how to mention it.
But these are all targeted therapy medication. So in stage 4 cancer is actually beyond cure. So we can only control the disease and maintain a patient's quality of life. And these are the targeted therapy which are very useful in.
But what he mentioned, can you mention is a more layman term, because if you tell me this, I don't know what is it.
Yeah.
How do you pronounce it? I don't even know how to pronounce it.
These are just medicine.
It's just a medicine.
Just name of
Okay,
medicine.
so in common term it will be
Targeted therapy medications.
okay.
Yeah, so it's not curing the cancer, it's not curing the stage 4 cancer, but it can put the cancer under very good control for quite a long time and maintains the quality of life.
Yeah.
Okay, just make sure that the cancers are not spreading, like
Yes,
or
yeah.
grow.
Yeah.
Okay.
Correct.
Those are watching. You got the answer you're seeking. And thank you very much, gentlemen, for sharing with us all your expertise. And hopefully we're gonna see you guys next time talk about others diseases. But once again, I hope you guys find out what you want to know. Okay, and thanks again. And my name is Theo. Thank you, Dr. Badrulhisham. Thank you, Dr. Ivan Shiu, and thank you, Stephen Kong. Okay, thank you very much. And this talk shows Prostate Cancer Facebook Live is brought to you by Sunway Medical Center. Okay, thank you. And
Okay.